In this video, I will walk you through completing Case 7-2 for applying your knowledge in the textbook, and from there you will be able to complete the remaining assignments from applying your knowledge on your own. Now when we go to page 267 in your textbook, you will see the preliminary information here for the cases. In the case that follows, you will play the role of a medical insurance specialist preparing HIPAA claim forms for transmission. So assume that you're working with the practice's PMP to enter the transactions. The information you enter is based on the patient information form and the encounter form. So here you have the basic information. Claim control numbers are created by adding 8-digit date to the patient account number. So this is what you would do. A copayment of $15 is collected from each Oxford PPO patient at the time of the visit, and $10 for the Oxford HMO patient. So that tells you copayment information. For these case studies, do not subtract the copayment from the charges. So this is important. For these case studies, do not subtract the copayment from the charges. The payer's allowed fees have already been reduced by the amount of the copayment. So keep that in mind. The patient uses NDC as his clearinghouse to transmit claims to practice. The necessary data for the payer and the clearinghouses are stored in the program's database. So here you have the provider information, it's Valley Associates. You have the billing provider address, you have the telephone number, you have the employer ID number. The rendering provider is Christopher Conley. You have his NPI number. You have the Oxford PPO provider number and the HMO provider number. And this practice does accept, or this physician does accept assignments. Now here you have information about the patient's name, sex, date of birth, address, the patient's employer, the insurance group plan. All of that information is here. This is the encounter form for that patient's visit to Dr. Connolly on that day. So it's Jennifer Porcelli. Her appointment was October the 4th at 12:30. She had two diagnoses. J04.0 is the ICD-10 code for acute streptococcal laryngitis, and B95.0 is the organism that was causing the laryngitis, so Streptococcus group A. Her procedure was for an office visit that was problem focus level 2, 99212, and the charge was $46. So you can see that all of this information can be obtained from the claim form. So as you go back, you answer the questions. What procedure code is being billed for this claim? It is procedure code 99212. These are the CPT procedure codes. List the name of the primary identification number of the billing provider for this claim. So you would look back and you would find the name of the billing provider. So the billing provider would be here, and you would get the primary identification number of the provider. All of that information would be gotten from here. Okay? Are the subscriber and the patient the same person? Yes, Jennifer Porcelli. What copayment is collected? So Jennifer has the Oxford Freedom PPO, and it tells you for the Oxford PPO that it's a $15 copay. So the copay would be $15. What amount is being billed on the claim? The amount that's being billed on the claim is $46. Remember that it told you not to subtract the copayment from the charges because the allowed fees have already been reduced by the amount of the copayment. So that's how you would go about answering the questions for this case. And you have the remaining cases, or the ones that have been assigned, that you're going to complete and put your answers in Connect.